Good day all, my name is Amanda Bernard and this is my presentation for Epidemiology 1, the topic antibiotic resistance, in particular at the Southwest Regional Health Authority. In this presentation we'll have definitions on antibiotics and antibiotics resistance. How is antibiotic resistance spread? Why is it important? How do bacteria become resistant to antibiotics? Causes of the resistance, what can be done, the impact, and the WHO. Antibiotics, also known as antimicrobial drugs, are drugs that fight infections caused by bacteria in both humans and animals. Antibiotics fight these infections either by killing the bacteria or making it difficult for the bacteria to grow and multiply. Antibiotics do not have any effect on viruses. Antibiotic resistance, therefore, is the ability of bacteria to resist the effects of an antibiotic. It occurs when bacteria change in a way that reduces the effectiveness of drugs, chemicals, or other agents designed to cure or prevent infections. The bacteria survive and continue to die, causing more harm. This is how antibiotic resistance spreads. We have where we could get animals that develop resistance to bacteria in their gut and we consume their meat, and the bacteria resistance is spread to humans. We can also have the fertilizer water containing the animal feces and the drug resistant bacteria being used on food crops, which we then consume and also develop the resistant bacteria. George can have poor regimes or poor management of antibiotic treatment, and it develops in him, which he can pass on to his general community, or if he's hospitalized and treated, he can spread it to other patients and to healthcare workers through unclean hands, unsafe practices, and the patient is discharged and enter the community, thereby spreading the infection. Important. Antibiotic resistance has been called one of the world's most pressing public health problems. Antibiotic resistance can cause illnesses that were once easily treatable with antibiotics to become dangerous infections, prolonging suffering for children and adults. Antibiotic-resistant bacteria can spread to family members, schoolmates, and co-workers and may threaten your community. Antibiotic-resistant bacteria are often more difficult to kill and definitely more expensive to treat. In some cases, the antibiotic-resistant infections can lead to serious disability or even death. Although some people think a person becomes resistant to specific drugs, bacteria, not the person that becomes resistant to the drugs. The growing threat of antibiotic resistance, and it is dangerously high in all parts of the world. New resistant mechanisms are emerging and spreading globally, threatening our ability to treat common infectious diseases. Bacteria become resistant to antibiotics. Some bacteria can neutralize an antibiotic by changing it in a way it makes it harmless. Others have learned how to pump the antibiotic back outside of the bacteria before it can do any harm. Some bacteria can change their outer structure so the antibiotic has no way to attach to the bacteria it is designed to kill. And bacteria can also become resistant through mutation of their genetics. Causes of antibiotic resistance: the indiscriminate and widespread use of antimicrobials for community-acquired infections, self-medicating, incomplete treatment courses, unregulated use of antibacterial drugs, and antibiotic use without the physician's. A short presentation from Dr.
Okay, my name is Dr. Burke. I am currently in the microbiology section in the pathology lab of the San Fernando General Hospital, which falls under the umbrella of the Southwest Regional Health Authority. So we are the primary microbiological lab under the Southwest, which covers about 600,000 people in the lower half of the island. So as one of the leading labs, we are aware of changing microbiological patterns of antibiotics resistance, and this is of great importance, especially in the hospital, because we have to be aware of something called antibiotic resistance. So we have several organisms right, of interest, but two of the major ones are Pseudomonas aeruginosa and methicillin-resistant Staphylococcus aureus. And these two, of among which are others, they contribute to nosocomial or hospital-acquired infections. So why is this important? Well, antibiotic resistance may result in multi-drug resistance, which means even simple infections could be more difficult to treat. And the antibiotic which it is sensitive to may be more expensive, more toxic, and more difficult to obtain by pharmacies. So there are several ways. I'll just name a few of which we can help to reduce the spread of multi-drug resistant organisms. And one would be that doctors need to be properly educated in inappropriate antibiotic prescription. Not everything requires an antibiotic, and this also contributes to microbiological resistance. Also, healthcare sensitization on clinical hygiene, that is to wash your hands between patients, and even clean stethoscopes between patients to avoid the spread of organism between patients. Last one would be the avoidance of over-the-counter prescription, dispensation, of antibiotics without a prescription by pharmacies. Right, so ultimately, the point of all this is that we do not want the outcome of all this to be pan-resistance, which would mean that there would be an organism, a microorganism, which is resistant to all agents in all antibiotic classes. A microorganism which is resistant to all agents in all antibiotic classes.
Here we just showed a protea species that is sensitive to antibiotics. You see that the large zones of sensitivity around the antibiotic disc. And the other one, the Pseudomonas aeruginosa, we see only two of the antibiotic discs, there are sensitivity zones around them. All other discs, there is resistance. We just summarize the antibiotic resistance, what you can do. Of course, when infections can no longer be treated by first-line antibiotics, more expensive medicines must be used, and longer duration of illness and treatment, often in hospitals, increases healthcare costs as well as the economic burden on families and on the society. Antibiotic resistance is putting the achievements of modern-day medicine at risk. Organ transplantations, chemotherapy, and surgery such as C-sections become more dangerous without effective antibiotics for the prevention and treatment of infections. Organization response global action plan on antimicrobial resistance to improve awareness and understanding of antimicrobial resistance, to strengthen surveillance and research, to reduce the incidence of infection, to optimize the use of antimicrobial medicines, and to ensure sustainable investment in counteracting and do have a